Thank you all for coming. This is a great day. We have a great announcement. I'm going to introduce some of the folks up here first. I'm Mark Bozegan, the city manager, and there's more people up here than my memory will allow. So I'm going to introduce the folks other than the board members of the Antelope Valley Partners for Health, who Michelle Kiefer will introduce when she speaks. We have Dr. Tuso representing Kaiser Permanente. You can clap too for Dr. Tuso. It's a great day. We're going to be happy about this. We have Amy Weiss from Kaiser Permanente. We have Michelle Kiefer, who will help me out. She represents Antelope Valley Partners for Health, and she'll introduce her board. Have a hand for our new superintendent of the Lancaster School District, Michelle Bowers. We have Council Member Ken Mann from Lancaster City Council. And we have Mayor Emeritus Henry Hearns representing everyone, as he always does. Thank you for joining us as we launch the Lancaster Heal Zone program. It's a partnership for healthy eating and active living here in the city of Lancaster. It was made possible by a grant from a great community benefactor and partner, Kaiser Permanente, a $300,000 Heal Zone grant. Let's give them a hand. And our finance department will not have to collect it because they have the check with them today, I'm told. So we have the check too. The award is actually to the Antelope Valley Partners for Health. Michelle will explain that, in partnership with the City of Lancaster and the Lancaster School District. A Heal Zone is an underserved area that has challenges that Kaiser Permanente already serves, but we want to target it with this grant. It's utilized by existing community organizations. It essentially gathers up those organizations, those folks that already serve the community, and the sum is better than each of the individual parts. So it brings those folks together. The problems in the Antelope Valley are well known. Our Mayor Rex Parris and the council, I applaud them, and I think they've done a great service to this valley by being the first council leader of the city that I know that's truly pointing out that we have health issues and we need to do something about it. Even though we depend on others, we need to all collectively do this together, and I applaud them for that. We have the highest mortality rate in LA County. More than 20% of the children in the Antelope Valley are overweight. Nearly 40% of the adults in the Antelope Valley are overweight, and 30% are classified as obese. Those are all unacceptable conditions. Those result in numerous diseases, which I'm sure Dr. Tuso can tell us about. The goal of this program is to fight obesity and improve wellness, healthy eating, activity, education, to essentially take an area of the city and say, we're going to help you out, we're going to give you the tools to eat better, exercise better, understand better the health conditions, and live a better life. It also encourages, when we talk about partnerships, it's not just organizations telling people what to do. It's bringing residents and families together and saying, you're responsible for your own health too. Here's the tools you need, here's the education you need, but you're responsible for your own health too. And it's one of the best programs we're going to do this year. We're exceedingly proud to be a partner with AV Partners for Health and the Lancaster School District. And to tell you about that is our council member Ken Mann.
Thank you, Mark. I appreciate being up here this morning and representing the city of Lancaster and the city council. One of the things that's really exciting to me is the aspects of the Heal Zone concept, as it requires a lot of teamwork and brings various groups together. And I showed up this morning and I see so many different faces from so many different groups, and to me that's extremely exciting. The Heal Zone combines existing efforts in our community wellness homes, the neighborhood impact homes, community gardens, and the Lancaster Master Plan for trails and bikeways. We've already got a large number of organizations that are involved and represented here today, as I've already spoken, and I'm sure there'll be many more that will be joining our ranks soon. I encourage today other organizations to join us. As the city manager has said, this is for lack of better words, I'm going to say a fight that we've taken on or we've embraced, is to really make a difference in our community. And I think by partnering all together and working together and multiplying our efforts, I think we're going to reach the maximum potential of what we're trying to accomplish here. So I want to thank everybody for coming out and supporting this program. Thank you.
Thank you, Councilmember Mann. I'd like to correct something I said, too. While councils haven't taken this on in the past, I believe, to this council, we did have a mayor who took it on and has been working on this in Partners for Health, and he really works behind the scenes. I know he's a well-known figure, but Mayor Emeritus Henry Hearns has worked on this for 20 years, so please give him a hand for being there all the time. Next, we have someone who also has worked with Mayor Emeritus Hearns and has worked and loves this community and has done the hard work of this community, making it healthier for 20 years. Please welcome Dr. Phil Tuso from Kaiser Permanente.
Thank you, Mark, and good morning to everybody. It's been, I just want to thank AVPH and Kaiser Permanente for giving me a few moments to talk today. And it's been a couple years since I've been here, so I'm a little anxious, if you can imagine that. But the last time I was here, Mark will remember, we sat down and had a conversation about the wellness homes. And we talked about a partnership then, and what a great job a lot of the people behind me have done with those efforts, and what a tremendous improvement that has done for our community to lay the groundwork for what we're going to do today. Since that time, I went on a HEAL sabbatical, a healthy eating, active living sabbatical. And for those that didn't know me a couple years ago, I was a little on the chunky side. Actually, I was categorized as obese. And over the last 2 years, I've lost 40 pounds and just finished my third half marathon. So I tell you that because at 50, if I could do it, just about anybody, I think, could do it, particularly our kids. So I believe what I'm about to tell you is very important. I'd like you just to listen to some of the key things, and I won't be long. But obesity, as we all know and we hear in the news, is an epidemic now. And from physicians, our standpoint, we see it as the #1 threat to health in the community for the future, from a financial standpoint, but also to the quality of life of our children. As was mentioned, 20% of our children in the United States are considered obese, and 35% of our adults are considered obese. And if you don't know, obesity leads to diabetes and hypertension. And those combinations can lead to strokes, blindness, heart attacks, renal failure, amputations, and dialysis. But the most important thing I'd like you to remember when you leave here today, that the best part about obesity is it's reversible and preventable. Diabetes from obesity is reversible and preventable. Hypertension or high blood pressure from obesity is reversible and preventable. Coronary artery disease and blood vessel disease, which causes strokes and heart attacks from obesity, is reversible and preventable. And that's a very important message as we go down this road, this HEAL, this healthy eating, active living track. Now, if you go to schools today and you happen to go to a restroom, you may see buckets of needles and used syringes. And that's not because the kids are shooting up with drugs like they were when I was in high school. It's because we have children that are obese that go to the restrooms during their breaks to check their sugars and give themselves subcutaneous shots of insulin to manage their diabetes while they're at school. It's terribly sad. It's estimated that if we continue on our track of unhealthy eating and lack of exercise, that 1/3 of our children will grow up to have diabetes with all the complications I mentioned. If we continue down this track that we're going, our generation, our children's generation, will be the first generation in American history that will have a life expectancy less than that of their parents. And if we go down this path, some of the senior leaders of our country are saying that obesity will kill this country from within. We won't be able to handle financial costs of taking care of all these people with diabetes as we go down this road. Now, it is for this reason that the leadership at Kaiser Permanente and the leadership in this community I'm very grateful for understand the importance of why we've created this HEAL grant program for Kaiser Permanente to share with this community. Kaiser Permanente believes that the cure for obesity is not pills, is not liposuction, is not gastric bypass surgery, is not the lap band. The cure for obesity is healthy eating and active living. It's simple, it's cost-effective, it's high-quality care, and it just doesn't get any better than that. And as a physician, I hope you can tell how passionate I am on understanding the importance of this for creating a healthy community for us. Now, Kaiser Permanente is proud to be a sponsor of this grant. As Mark said, I've lived here 20 years, my family lives here, I have a great love for this community. And I'm proud, as from Kaiser Permanente standpoint, to be a partner in this grant, that not only are we going to give some financial support, but we want to be at the table to help and to guide and to work with the other community leaders to help work on this. So from our standpoint, we think this is a very important first step, that we could all come together and work together for one common goal, to, as a group, work to continue to improve the health care of the community we serve. Thank you.
Thank you, Dr. Tuso. That message should be required for all community leaders and parents to hear early on. Those are sobering statistics. Next, I'd like to introduce someone who really has done an exceptional job of working with this community, pulling a lot of folks together, getting as much out of them as possible and leaving a little more than they thought they can give, and really just has an incredible amount of energy and someone we love working with the City of Lancaster. That's Michelle Kiefer from AV Partners for Health.
This has been quite a journey, and we have a whole nother journey to go on. First, I want to do my business of introducing my board members that are here with me today, who, without them, really honestly, these are board members that have been here almost from the inception of AVPH, we would not be here today. So we have Dixie Iliopoulos, Dr. Tuso, George Giese, Bishop Hearns, and Mel Grusing. And of course, all my staff sitting in the audience that I would not be here today without them. They are amazing to work with. So this is quite an honor to receive this grant from Kaiser. We have a lot of work to do, as Dr. Tuso has said. I think Dr. Tuso and I started this about 3 years ago on our Healthy People Initiative train ride, basically, to every town council that would hear us and everybody else, to kind of get this message out that we need to make serious changes. The vision of the HEAL Partnership is for people to eat better and be more active. These are very easy things to do, but for some odd reason, it's very hard to get people to do it. I'm not really sure why. I know it's convenience issues and things like that, but we need to make sure that people understand this is top priority. Being healthy, eating healthy, and being active makes you feel better, and it makes your life more productive, really, in the end, and more healthy. The Heal Zone project started, Kaiser really is trying to focus on a pocket community of 10 to 20,000 community members to really look at that and try to make impact with those community members. Once we do this, we are going to duplicate it everywhere we can, everybody. So we're really trying to do evidence-based practices and even best practices and new practices. The wellness homes is a perfect example of a new practice that is working wonderfully in the communities. And neighborhoods are where we have to go to. This is where we're going to make our change. This is where we're going to get people to eat healthier, go to grocery stores and have them promote the healthier items instead of having the chips and the Velveetas on the end caps. The vision of the HEAL Partnership is really to work with the school districts and the schools. This is where Our kids are most of their day. Our workplace, this is where we are most of our day. Making sure that our businesses and our schools are really focusing on supporting health and healthy eating activities. We are so honored to be working with the School of Lancaster District. They are so innovative and really, really supportive and share our vision in this. And they understand that the change has to start with our children. And we really are looking forward to making that partnership even stronger. The focus and the specific goals of the HEAL Zone is to decrease calorie consumption, increase consumption of healthy foods and beverages, include water is the cheapest healthy beverage we can have, so everybody should focus on drinking a lot of water, and increase physical activity, and that includes making parks safer, having our walking paths and bikeways, and so it really ties into the goals of the City of Lancaster, who is really focused on making this a healthy community. I want to thank Kaiser. They're an invaluable partner in this. I want to thank our community-based organizations. This is going to take a village. This is not going to take AVPH. This is going to take every single one of us, all of our community-based organizations, all of our businesses, all of our city officials, all of our residents. We need to be healthier here. And we would not be able to do this without all of you. And so I really appreciate everybody's participation in this, everybody's voice in this. You know, it's kind of like that old shampoo commercial, tell a friend. That's what we need to do. Everybody needs to get out. It's a social change we're trying to do here, to be healthy, eat healthy, and be active. And I appreciate your support, and I look forward to working with all of you to make this change in our community. Thank you.
Thank you, Michelle. Who we have now is Amy Weiss. She represents Kaiser Permanente. I had the honor of having a couple meetings with Amy, and you could tell that she embodies the spirit of Kaiser and cares about the community, which is preventative care and people living better lives and quality of life. And Kaiser's been a great partner, and Ms. Weiss is a great representative. So I'd like to introduce Amy Weiss.
Well, thank you. My name's Amy Weiss. You won't see me at the podium a lot. I'm usually working a lot behind the scenes with our nonprofit organizations, our city representatives, a lot of organizations in the community to address community health. I am a senior community benefit health specialist, and what I do is handle a lot of our grant programs. I leverage a lot of Kaiser Permanente resources in the community. Dr. Philip Tuso is one of those huge resources for this community, and I really do a lot to support his efforts in this community as well. So what I'm going to do is just tell you very briefly a little bit about where did the HEAL Zone and grant partnership come from? Where did this concept come from? So inspired by our mission to improve community health, Kaiser Permanente developed the HEAL program in 2004 to support healthy behaviors and reduce obesity through clinical practice, but sustained community level change as well. Since that time, Kaiser Permanente has committed over $21 million to support HEAL efforts across Southern California. We've learned a lot from those efforts, and we are looking to apply those learnings to this partnership here. The Lancaster HEAL Zone Partnership Grant is one of 9 HEAL Zone grants being provided throughout Southern California. So this isn't the only one, but I will say I've been at the table on both sides of the table. I've been an advocate for the Antelope Valley actually receiving this grant, but I've also been on the other side as a funder working with my community benefit partners at our Southern California offices, evaluating a lot of these other partnerships that could exist. And I will say, one of the best assets for the Antelope Valley is the partnerships that already exist here. And that was a huge piece of deciding to fund this partnership. You all have already been working together, doing wonderful work. And this is really meant to boost that effort and further those partnerships and that work that you guys are already doing together. So I applaud all of you for the work that you've been doing over, the past 20, 30 years together. And we really appreciate that you're all here together to move that work forward and really make this, a healthier community. We are thrilled to be investing $300,000 in funding for the Lancaster Heal Zone Partnership Grant. And Kaiser Permanente is not only is a partner in the communities we serve, and not only as a local business and employer, but as a healthcare provider. This is a natural extension of our mission, which is to not only take care of the members that we serve, but really the communities that we serve. And this is a prime example of not only providing the funding, but really coming to the table to provide, like I said, leveraging our Kaiser Permanente assets where we can to move this work forward as well. So we're not only a funder, but we're a partner in this process as well. We're excited to be an active partner, and mostly I would just like to thank those up here who have already signed on to this partnership, and for any of those who are actually going to be working with us to move this work forward. We appreciate the work that you've already done to improve the health of the community, and we look forward to making the healthy choice the easy choice in this community moving forward. So thank you very much.
And it's a pleasure to introduce the new leader of the Lancaster School District, the superintendent, someone who is the right person at the right time, and we're looking forward to working with. I'd like to introduce Superintendent Michelle Bowers.
Well, good morning, and thank you very much. On behalf of Lancaster School District, I would like to say thank you to both Kaiser Permanente and AV Partners for Health, because we are committed to educating the full child, and we cannot ignore healthy eating and active living. That absolutely has to be a part of it. We have 4 schools in Lancaster School District that are part of the targeted zone for the Hill Zone grant. 3 elementary schools, which include Mariposa Elementary School, Desert View Elementary, and Linda Verde Elementary. We also have a middle school that is going to be participating in that target zone area, and that's Paiute Middle School. We have the principal with us here today. We also have our child nutrition director, because we have every member of those school communities partnering and involved. And again, fully committed to making sure that we do everything that we possibly can to ensure that all of our students and their families have all of the resources and the information they need to be fully educated. We know with those healthy bodies are going to come healthy minds. Heal Zone is going to give us the resources and the support that we need to make healthy eating and active living a part of what we do 24 hours a day, 7 days a week. Not something that just happens or is discussed during the school day. So I thank you again to Kaiser, and thank you to AV Partners for Health, and thank you to the city for their support, which we also have in several other programs. So it is going to take the work and the effort of the full community and of the entire village, and for that I say thank you to all of the people here today, and we look forward to the work that we're going to be doing together. Thank you.
Really is refreshing to work with the school district that takes chances and really tries to look at things beyond the border of their schools. And Michelle, I apologize for stumbling over your name. There's too many Michelles up here. Had a bit of a senior moment there. With that, I believe we have a check presentation.
Yeah. I don't know if you can catch that.
We'll try. Before we leave, Angela Riley will escort those who are at the workshop. Those that are going to the workshop afterwards, she'll escort you. And then for the media, these folks will be available to talk to afterwards. I was remiss, I want to introduce one more person from our Lancaster School District Board of Directors, Diane Grooms. Thank you all for coming. We really do want the organizations you represent to partner with us, so don't leave without talking to someone. Thank you.